Check it out. GERO 200, spring 2022. It's me again. I'm back 5 minutes later. Okay. So, um, hopefully you just saw the how to get an A, okay, video. All right. And it'll help guide you in terms of just ultimate success in this class. Okay. Alrighty. A lot of the principles I talked about in terms of that class will guide you towards ultimate success in all your classes. Just don't get behind, make it just part of your daily routine. Routine is key. All right. And our routine every week is to basically come over here and find out what's going on this week in GERO 200. All right. So I would click right here. Okay. What I'm going to do is scroll right down here. Okay. I'm going to click right there. All right. All right. I would click right here. Guess what? It's going to come right back up. I'm going to open it. All right. Cool, 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 cool. And we're going to go through this. Now, what do I want to do to make this easier on me? Okay. As I'm reading through this, okay, I am going to scroll down. All right. And I'm going to find out what kind of reading quiz I have. All right. So we'll check it out. Hit continue. All right, I'm going to take a quick gander at the questions. All right, so that way, when the material that is relevant to these questions pops up in our reading, you're like, oh yeah, this is where I'm going to find this. So on a global level, so that means the entire world, the 85 and older population is projected to increase by what percentage between 2005 and 2030? All right, I'm going to read that. Okay, I'm going to look at these numbers, and then as I'm going through, I'm going to make sure that's reasonable. It says now among developed countries like us, okay, like France, like US and Canada, which country has the slowest speed of population aging, right? So we're going to find out, okay? You're going to see there's a figure that will give us information on that. All right, then we say, what do we expect to be the leading cause of death in the next 10 years? Okay, is it going to be communicable diseases? We never would have thought that, okay, until COVID. Okay, COVID is a communicable infectious disease. Okay, it was a game changer. Okay, this chapter we're reading was the most recent one that's been put out by the World Health Organization and the National Institute on Aging. Hopefully they'll be getting a new one out soon, and they're going to rewrite that chapter, so to speak. Okay. All right, non-communicable diseases, okay? What are those? Cancer, all right? Diabetes, okay? Heart disease, Alzheimer's, things like that, okay? Communicable diseases in developing countries, but not communicable in developed countries, okay? Injuries. So which one? To me, what makes the most sense there? Obviously, we're getting rid of all those, things that, those kinds of diseases that are infectious, that are hygiene. Hopefully the injuries are not a big deal. So I think the answer is obvious. You look at this. The following is true of countries like the US and Japan that have growing numbers of people over the age of 65. All right. Do we have a lot of reproduction? Okay. A lot of procreation? All right. Or do we have low fertility? All right. Do we have long life expectancies at birth compared to, say, living in Afghanistan? All right. A developing country versus a developed country, all right? Have we reduced the impact of infectious diseases, chronic, and increased the impact of chronic, long-lasting diseases, okay? What's true relative for these countries, okay? Just think if we didn't have vaccinations, okay? Is it all of the above? Okay, all of the above sounds reasonable to me. Which country experienced the most striking increase on a percentile basis of its oldest old 85 plus population by 2030? Okay, all right, so we're going to see which one is it. France, they already got there, okay, probably, but my guess it would be India if I had to guess. Let's go find out, right? So then what we do is we come over here to our PDF file, okay, and we kind of read through it. All right, so let's do that. All right, so I'm going to strike it down a little bit here. Maybe I'll go to 85%. Okay, awesome. Okay, all right. Take my arrow and let's see what's going on. Okay, you see the group that is put together here. All right, so this is government sponsored. All right, Yeah, there are huge components to government funding. One of them is the National Institute of Health. Okay, we heard a lot from Francis Collins. He was the director of the National Institute of Health. He's stepping down right now. Okay, um, Fauci is the director of a subcomponent of the National Institute of Health. Okay, it's infectious disease and allergies. Okay, then we have another director of the National Institute on Aging. Okay, this is all part of the Department of Health and Human Services. Okay, also includes CDC. Okay, also includes the Food and Drug Administration, right? And this is part of our federal government, the Department of State. So that gives you kind of a feeling where this is all coming through. Now, this was what we're doing if we went back to the request, okay, is we're going through from forward through trend 5, okay, so and that's where you stop, and then next week you're going to do trend 6 through end note, okay. So we're going to do forward through trend 5. And the forward, they kind of indicate what's going on here, all right? So this is global aging, all right? And it's really, really, the reason global aging is so important is many countries around the globe are really looking towards developed countries, countries like ourselves that have this significant funding apparatus that I was just talking about that goes into doing the scientific analysis. Now, science isn't just biology. Scientific analysis is looking at population trends, epidemiology, sociological trends, economic trends, okay? Business trends, all these things. So there's funding that goes out there so that, that the think tanks full of these people uh, can analyze what's going on and make predictions, okay, so that life is better. And that's what it's all about. You know, we're all always trying to make life better. All right, cool. Um, so all these countries around the world are looking at the United States because we do have this amazing scientific community to come up with answers. Okay, so we're going to share this information, all right, and make the world a better place. Okay, and by making the world a better place, then we can go to different parts of the world and have a blast. Okay, so amongst other things. All right. So reason I'm talking about that. So basically, this study was using data from the World Health Organization and the World Data Bank. Okay, we're going to use that World Data Bank for our first critical thinking assignment. Okay, they look at things like the burden of disease. Okay, so the financial consequences of this infectious disease was enormous. Okay, but then separate from that, you know, we have diseases of aging. Okay, that were really frontline and will continue to be frontline when we finally figure out the proper remedies to make the issue of COVID go away. Okay. And that's diseases, like I said, like cancer and diabetes, Alzheimer's, all the things we see listed down here, cardiovascular disease. This is a big burden. It's a burden on the individuals. It's a burden on you as a caregiver if your parent has cancer or heart disease. It's a financial burden, okay? It is an economic burden at the state and federal level, okay? So these are big deals, all right? It is a global thing, and some countries are better off than others. Okay, and so that's what this is all about. Okay, all right. So this report is looking at, you know, again, you know, members of the global community. Okay, and that's what we're talking about right here. Okay, that are all grappling with the same issues. All right. So here's a little overview. Okay, and you know, it kind of starts with some shock and awe. Okay, so the shock and awe is okay. Sorry, making my. I'm done with this. Okay, awesome. I was trying to use something else, but I'm going to go right back up here. There. Shock and awe is showing you right here. All right. So 2006, this study was put out about 2015, but in 2006, 500 million people worldwide were 65 and older. Okay. 2030, it's going to double. Okay, to a billion. 1 in every 8, okay, Earth's inhabitants will be 65 and older. Okay. And we're going to see, you know, on a percentile basis, naturally, if these numbers are going up, mostly in older people and not so much in the other generations, that it's going to be a bigger piece of the pile, a higher percentile, right? So this overview right here just kind of goes through what we're going to do when we look through, all the chapters. So we're going to go through this overview all the way through chapter 5, and then down below that we go from chapter 6 to the end note. Okay, so we're going to look at kind of the global overall look at population. We're going to look at life expectancy. Okay, now we actually had a big drop in life expectancy over the last 2 years. Why is that? Okay, because so many people died from COVID-19. Okay, it is what it is, and that's how you do this type of population slash epidemiology analysis in terms of life expectancy. All right. Um, when you don't have an infectious disease and you cure, and we are going to cure COVID real soon. We're going to put it in our review mirror. Um, and then we start going back and grappling with diseases that kind of hit you in middle life, diabetes, okay, heart disease, okay, and we just keep pushing the envelope. And so what happens is people live longer and longer. Life expectancy increases, and we see that people over the age of 85, if we give that as a category, they're the fastest growing people. So there's a discussion of that, okay? Now, like I was talking about, okay, this was a huge abnormal blip, okay? The communicable, communicable means it's easily transmitted infectious disease of COVID, okay, that came from SARS-CoV-2. It was a blip. It was an abnormality. Usually science is able to get, nail these things, but this thing was different, okay? It was novel. Separate from that, most developed countries are dealing with, and now even developing countries are dealing with the long-term consequences of a chronic disease, chronic means it takes 5, 10, 15, 20 years. Going from diabetes and heart disease and kidney disease, from diabetes on to cancer, and then even all the different forms of dementia, especially Alzheimer's, okay? All right, so while we have this kind of population momentum, where yes, we do reproduce and the population expands, it has been slowing. This momentum has been slowing, and so we're going to see, which countries are going to actually see shrinking populations. Okay, and why is that? Okay, you have growing people over the age of 85. Okay, but you have less fertility. It's so hard to survive. We're seeing that in our country. People are delaying reproduction, or just foregoing reproduction. Okay, so these are issues that are going to be talked about. If you have less kids, less grandchildren, less people that can provide support, caregiving, both emotional, instrumental, you're cleaning house and things like that, cooking, going to the store, there's a big change in terms of the burden of caregiving. Okay, you have fewer children, then either people peripherally, friends have to help, neighborhoods have to help, more burden on the individual child or individual grandchild, or you farm it out, okay, in terms of long-term care facilities. All right, it's a changing world. Okay, that's not the way it's done elsewhere, but that's the way it is done here in our country quite a bit. Okay, uh, because of this, and because of also the fact that we have we're all living longer. We need more money. We're going to see this pattern. When do I retire? Governments are saying, you know what? We can't give you a pension anymore. We can't guarantee you an income anymore. It's up to you to invest. All these things are changing. Okay, this is always part of discussion at the level of the U.S. Senate and our Congress. Okay, the president, and this is social insurance systems. Okay, what is that? That's Social Security. Okay, that's Medicare. All right, which you become eligible for Medicare when you're age 65. Okay, how do we continue to guarantee these social insurance systems? Okay, they cost money. If more and more people are older, it's an issue, okay, because we have to fund these systems, okay? So that's something else that is a challenge, okay? And these are all, like I said, economic challenges, okay? Um, if we have fewer people being born, um, we have fewer people to do the work, okay? So it's a big deal, all right? All right, so right now is a, we call this a window of opportunity. That's what you guys are, you're on the planning stage to figure this out and make things happen, okay? All right, the cost of waiting. If we don't get on this, okay, then there's going to be an issue. Okay, so we're looking at this huge triumph of public health. Okay, what we've done, you may be hard to believe, what we've done with COVID-19. And like I said, we've had roughly 1.5 million people die in our country because of COVID. You know, I know the verified tested sample death for COVID is around 830, 40,000, but realistically we've had a lot more people die. Um, if we didn't have public health and science, we would have had, I don't know, 20 million people die in our country, 30 million people. So it's still a triumph, okay? A triumph of medical advancement, as is, we're going to see later on, some of the inroads we made in terms of cancer, diabetes, and etc. Okay, um, so it's causing this big increase in life expectancy. Okay, so what we're looking at here, okay, so as we're extending life expectancy, we got to prepare for the fact that we're all going to live older. You know, I mean, it is crazy to think. I look at my dad when he was my age compared to the way I lived my life. There's a huge, big difference in terms of our approaches to life. You know, my dad he retired at 65. He sat around and watched TV. You know, I'm still going out there doing things all the time. You know, I don't plan on retiring right now. It's too much fun doing this. Okay. All right. So, a big part of this also is since I'm going to live till I'm 95, I better make sure I have the financial resources to live a comfortable life, okay? To also be able to support my kids, because there's been a change in that whole transition as well in terms of how much training you guys need as young adults, okay? And you need more training, okay? And so we need to be able to help our kids out more. All right. Now, a big thing we're going to talk about, we're going to see it in our CT1, is what happens if you just put a little money away. Now, this right here is incredibly conservative. Okay, having a return on investment of 5% a year. I'm looking at the last couple of years of really between 8 and 10%. Okay, and so for every dollar I put away, then I'm going to make 10 cents on that dollar. Okay, which is awesome. Okay, and then the following year, when the interest I make 10 cents, you make 10 cents on that dollar and 10 cents. And you see how it just compounds and grows and grows and grows. Okay, with this conservative estimate, 5% a year. And when you're 40 years old, okay, you put away 10 grand a year, which is, you're thinking about it, that's going to be easy to do. By the time you're 70, that's 700 grand because of this compounding interest, okay? If you start earlier in life, and this is what we're going to try and convince you guys to do, then you don't have to put away as much to get the same amount, okay? Realistically, the way the stock market has been going, and again, we're going to train you how to do this on your own, so somebody doesn't have to take 2% of your assets annually, okay? You can do it for almost free. If you just use your own website, you can do it 0.01% fees just for using the website. It's like a game too. We're going to guarantee you more, something like 2.5 million here, okay? Or more, maybe 10, 20 million, okay? It just depends what you do, okay? All righty, so there's a lot more pressure for us to do this individually, all right? Countries globally, okay, are looking at this need for this pension reform, okay? A pension is different from what I was just talking about, okay? I was just talking about my own money, a defined contribution. I'm defining how much I'm going to contribute to my retirement, okay, so that I will be comfortable in my retirement, okay? Way back when, okay, big companies and governments, okay, would guarantee, the more socialized governments guarantee a certain standard of living, a pension, okay. We have subsistence below poverty line guarantee called Social Security. It's not enough to live on, believe me, okay. But other countries, European countries have a huge commitment to these pensions, okay? And now economically, they're being crushed under this burden and they're having to rethink it, okay? So that's what's talked about over here, how the European Union is having major discussions about what is it we're going to do. Again, the European Union, what is it we're going to do to be able to fund these pensions, right? All right, cool. All right, so aging population. Okay, so this is kind of just again the shock and awe. Looking at what's going around globally and the shift that we talked about earlier. Okay, so I really like this figure right here because it really shows you the shift that is happening in terms of sociological dependence. Okay, all right. So whether it be a government, okay, or a family unit, a community, okay. Sadly, when you get older, you're more dependent, okay, on support, okay. And just kind of as an earmark for looking at this, if we look at people that are over the age of 65, okay, and then the other earmark is we're looking at people under the age of 5 right here, all right, okay. We're looking at the percent of the global population, and we're going from 1950 over here to 2050, okay. So that's a 100-year span here. So back in the day, people didn't live that long, okay. And so they were a very small percent dependent on resources from, say, the community, the government, and also from their kids, okay, that maybe are 20 or 30 years younger than them, okay. People had more kids back then, okay, so it was the norm to have 4 to 7 kids in this range right here, and then you see that the transition began to happen, okay, so we start getting rid of diseases, okay. The quality of life started improving in developed countries, okay, and so we start seeing globally, okay, that the number of people age 65 that are dependent went up, whereas the number of people younger went down and down on a percentile basis, okay. So this shows you where the resources are going to be going. Less resources for kids, more resources for older people, okay? And it really changes social structure. Okay, so who's got it going on and who doesn't? So this was one of my questions on my quiz, all right? So I'd be going back and forth with the quiz right now, all right? So we look at developed countries, okay? And this is, a sociological categorization, okay? And it has to do a lot to do with how rural versus urban, how industrialized versus non-industrialized a country is, okay? See that China is still considered, believe it or not, as a developing country because there's so much rural China that is still pretty underdeveloped, okay? All right. All right, so look at these developed countries. Again, this was just a way to study. So as a demographers, they wanted to study it, and they wanted to look at how long it took for a country to go from 7 to 14% of the population being 65 or older. That's what they're looking at here. They look right here, all right, the older European nations had quite a bit of time, right? So we see right here that it was almost 100 years, okay, for France to figure things out, all right? So this is a gradual change. Same thing with Sweden, about 100 years, okay? I'm just approximating here, okay? Fewer years right here, okay? For Australia. For us, it was about 70 to reach that earmark, okay? Down and down here. And then one country that is of note that had very little opportunity to be ready for this, but they were technological, okay? They are very much so a developed country, and that was Japan. And so we, as a world, as a globe, look at Japan and say, they had to come up with the answers to this huge transition in terms of the percentile basis being older for older people a lot more quickly. And so they're on it. Japan has been on it. They're also suffering under the crush of some issues, okay, where there's a lot of older people, no children to do the caregiving. And so what do we do then, okay? All righty. So this is a lot, that's all historic, okay? Now these guys, it's happening right now, all right? So these are developing countries, okay? Chile, Azerbaijan, okay? Thailand, Colombia, on and on and on, okay? They're going to be, and this is just, you know, a study-based earmark, but it does reflect this big increase in the aging community in each of these countries. And they're not going to have the infrastructure and technological savvy that we have to deal with it. So they're going to be, this is like this global opportunity. So as you get trained up in all this stuff, there's a really good chance that you can go to Chile or Colombia or Singapore or wherever it is around the world and give them some guidance, okay, in terms of, you know, one of our good friends, Josh Johnson, who's a faculty member at SC, that was exactly what happened. So he was a administrator for an assisted living facility here in Aliso Viejo, and then he had the opportunity to move to China. He lived there for a number of years, and they paid him handsomely to help design um, nursing facilities, assisted living facilities outside Shanghai. And then once he was able to build his resources, he came back with all that money, and then he helped develop a number of really nice high-end facilities here all across the country. So it was an amazing success story that was based on a U.S. guy going globally to fix the problems elsewhere. Okay. All right. Cool. Let's continue on in our journey. Okay. All right. So increasing life expectancy. Sorry, my mouse is being all tweaky. All right. All right. So we see what are some of the issues that society sees with this increase in life expectancy. Okay. All right, so you know, we talk about this steady increase since World War II. You know, some exceptions, okay? Latin America, okay? Africa. Part of that is they were not so urbanized, still very rural, okay? Still very dependent on having children that would help in terms of farming and maybe fertility, drugs, and also um, um, prevention um, of having kids. Okay, contraception hadn't quite reached there. Okay, I was grappling for contraception for some reason. Okay, um, and so the other thing that happened is since they are not science-based, so epidemics hit them hard, hit them really hard. Okay, so we'll see what happens globally um, if the COVID-19 vaccinations don't get to South America, parts of Asia, and Africa quickly enough. Okay, all right. So it's going to reduce the life expectancy. Okay. For countries that do have extended life expectancies, okay, there's been this shift. Okay. We see a shift in to low fertility rates. Okay. What does that mean? Okay. You're not having kids. All right. And the steady increase of life expectancy. Okay. And the other shift that we saw, okay, was away from infectious diseases. Okay, and this growing impact, like I said, of diseases like cancer and heart disease, which are non-communicable disease. Okay, so this talks about this health transition. Okay, we have this increased survival rate. Okay, and so this is just an example of looking here at the United States. Okay, and again, this is 2003. God, I don't remember when this publication was done. I think it was close. I said 2013. I think here I'm gonna see on my page. I'm at section 1.9 and go find out here because it's bugging me when this thing was done. I'm looking to see. I should know and I don't know. Yeah. Anyway, I think it was around 2008 or so. Anyways, okay, let's go back to that figure. Sorry. Okay, so this is, you know, it's an interesting way of looking at the population. So we're all born right here, all right? Age 0, okay, all right? We're all 100% alive. That's what this is, right? So this is how many people are alive, okay? We're all, boom, right out of the blocks. It's like a horse race, okay? Okay? And then let's see how many people make it to 10, how many people make it to 20, how many people make it to 100 years of age, okay? So in our country, okay, turn of the other century, 1901, um, boom, there was a lot of what's called infant mortality. Okay, why was that? Because we didn't have good hygiene back then. We had a lot of infectious diseases that killed off the youngsters. Okay, a lot of other issues killed off the youngsters. Okay, so we looked like at the average life expectancy for everybody that was born in 1901, and you see this right around here. Okay, so it's gonna be right around 60 years of age. Okay. Fast forward to 2003, we've got things in place. We got lots of sewage treatment. Okay, we got our water districts. We got vaccinations. We got antibiotics. Bum 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 bum. All this stuff that science has helped us do. And so then out of the blocks, everybody's living for the most part. 99% are living to say age 20. Okay. If we get rid of some of the early non-communicable issues, and so when we look out here, and that we see that the average 50% life expectancy is out here approaching 80. Okay, all right, that's how that is read. So we see that, and again, this is another plot, and this is verbiage that supports these figures. It shows you these changes in life expectancy. Okay, and we see that women had a greater rise than men. Okay, and there's some issues with that. Some of it had to do with sociological issues, and other parts of it have to do with biological issues. Sociological, men were doing jobs that had a greater likelihood of causing early death. Women have different physiology based on estrogen levels that help protect them against diseases like heart disease. Okay. All righty. Cool. Rising number of the oldest old. All right. All right. So we see again the consequences then of having these big guys. All right. These many more older people. All right. And so what are the economic consequences? Okay. So we as a society are going to have to cover pensions, retirement income for a longer period of life. Healthcare costs rise. Okay, so that's a huge issue. Okay, if you're going into healthcare, you're going to be a doctor. You see, the majority of your patients are older people. Okay, majority of the money going out in terms of payment for healthcare is from older people. Okay, and so it's something that you have to deal with as a society. We see this transition in terms of generational relationships. Okay, kids are staying at home longer. Okay, a lot of us are having kids later in life. You're less likely to get to know your grandparents. You're going to be more likely to have to care for your parents. These are all these transitions. Okay, so we're going to see this growth in people that are the oldest old, centenarians, etc. Okay, and we see this here. Global level talks about 85 and over. Okay, and this was that first question that I was looking at. Okay, so from 2005 to 2030. Okay, we see that the answer to that question was bump 151%. All right. So again, this is again, you reflect back to your quiz to answer these questions. Okay. All right, it's going to vary. We see here, okay, considerably from country to country. It all depends on where you are at in terms of being developed, technological, and having social support. That's what this is all about. Okay. All right. Cool. Now we're looking right here again. The big ones. All right. We said, people 85 and over on a percentile basis, they're going to see the biggest percentile basis jump at 150%. So there's the answer to that question again here. All right. We see these people are going to show the biggest jump in terms of population component right here. All right. So the biggest population increase right here on a percentile basis. You see, there's few centenarians, but they have the biggest percentile increase. Okay. So what is the big burden? I've been referring to this. This has part of our economics, our gross domestic product going towards this. Okay, your individual economics, out-of-pocket expenses. All this is a reflection of these non-communicable chronic diseases of aging. Okay, that is going to be a biggie. Okay, all right, and so they look at estimates right here. Okay, 2002. Um, Non-communicable diseases accounted for 85% of the burden of disease in high-income countries. Okay, and only 40% in low-income countries. Okay, so people just don't live long enough for cancer and heart disease to be as big an issue in these other countries, and that was why. Okay, the longer you live, the bigger the issue that becomes. Okay, so we can see right here as we're looking, and I'm going to phone down so we can see the scale right here. This is looking at high income versus low income countries. You see that the communicable disease, the infectious diseases that can be from a virus, can be from tainted water, poor refrigeration. It seems like something that shouldn't be an issue, but it is, and it makes up. You see this transition, 44 to 32% of the burden of disease for these countries that are low and middle income. More advanced societies, it's going to go from 6 to 3%. It's become less and less of an issue. We learned so much from coronavirus that we're going to be a lot more equipped for the next one. And there'll be a next one, my friends, sadly. Okay? The non-communicable disease, you see it's a smaller burden here. You compare 2002, okay, 44% here to 85% for high-income countries. And still it's going to be a fairly low percentage for the low-income countries, but you see right here, it dominates the high-income countries in terms of our situation, all right? All right, cool. Oops, sorry, didn't mean to do that. I meant to do this. Okay, cool. All righty. So we're going to see this. This is our last chapter. Okay, we're going to see population decline and what that is going to do to us. Okay, so we look at countries that are going to be hardest hit, projected to see the hardest hit going from 2006 to 2030 here. Okay, the big one is Russia. Okay, all right, they're going to see a huge population decline. All right, more older people, less reproduction. Okay, a lot more immigration. Get the heck out of Russia. I would right now. Doesn't seem like especially in the winter, who wants to be there? Okay, big population decline. You see right here in Japan. Okay, on and on and on and on. All right, and we look at Russia as the example. Okay, and we're looking at the going again from 2006 to 2030, and this is just looking at numbers, okay? So this is raw numbers in hundreds of thousands of people. We see increases in centenarians, people over the age of 95, people in this group 85 to 90, on and on and on. So this is projected increases, and you see down here all these younger age groups are going the opposite direction. All right, so nobody's replacing as you go from 26 to 2030. There's not a replacement of these guys. Okay, these guys are aging out, going upward. Okay, awesome. All right, so Russia's going to have a lot of stuff to deal with, as are other countries as well. All right, so that's the drill right there. All right, so this is an overview. Okay, so I just want you to take this in stride, and then you're going to see. We're going to go into details, and we're going to do this over and over again as the semester continues forward. All right. So that's what we do right there. Okay. What you next have to do is you're going to go back over here. Yeah, I want to leave this. Okay. And I showed this in the how-to video. If you haven't seen the how-to video, what we need to do is we need to go into right here and introduce yourself. Okay. And that's what this is all about, So we want you to tell us how you see yourself using the knowledge gained through this class in life. If you want, you can post a photo of yourself, post pets, whatever it is. But address this prompt. You click on it, okay? You create a thread like so, okay? And there it is. You title it. So this could be Bella Walsh's title, okay, my dog. Type away how you're going to use this course. about yourself, throw in a photo. We don't care. It's all good. Okay. Um, and then you hit submit. Okay. Alternatively, okay, I'm getting out of here. That's 0.75 points. The other remaining half of your grade is going to come from posting on somebody else's stuff. Okay. So Doc Wash posted. That's me. Then you hit reply. And you respond to this. Okay, awesome. That's what it's all about. Okay, you do that 3 times, you're done for the week. Okay, so hopefully you guys find this class rewarding. Do contact us if you have any issues about anything. Okay, and it was fairly long-winded, but that's all good, guys. So we're gonna see you next time. What I need to do is say adios to this. There we are on the beach. How awesome is that? All right, and peace. We'll see you next week.